So stress urinary incontinence is the inability to hold or control urination at time of increased pressure in the abdomen, such as laughing, sneezing, or jumping or exercising. So you feel yourself leaking urine, not willingly during these stressful activities. The causes of stress urinary incontinence can be due to a number of reasons. Most commonly, we see patients who underwent cancer therapy, such as radiation therapy for prostate cancer, as well as surgery for prostate cancer. There are also specific pelvic trauma that can lead to incontinence of urine during stress. Again, as a urologist, I think seeing patients with post-surgery can be the most common type of stress urinary incontinence in my practice. It's often self-diagnosed. Patient will come complaining about leakage of urine when they are sneezing, coughing, laughing, and it can be demonstrated in the office by seeing the pads per day use, noticing they're leaking when they are stressing themselves. These are the most common type of evaluation that indicate underlying stress urinary incontinence. It's critical to see a specialist who specializes in this because you oftentimes require some special evaluation as well as special treatment for these conditions. Treatment can range from penile clamps, which is an external device that can be clamping over the penis to prevent the leakage from happening at the time of, again, stress activities like exercising. There's also a sling, we call the male sling, or the virtual male sling, that can be placed around the urethra to hold the urethra and the bladder in a position that can be controlling urination in a better fashion. Depending on the severity of the stress urinary incontinence, how much the patient is bothered with the stress urinary incontinence, there are options, as I mentioned, ranging from penile clamps to the male virtue sling that require procedure. We do evaluation on the bother of the patient, as well as the pad per day use, how wet they are, how many pads they're using per day, how much wetness in the pads, and as well as how much affecting their quality of life. There are more specific testing we do in terms of doing a cystoscopy, which is a camera examination of the bladder to establish they don't have any underlying anatomical problems in their bladder or urethra. Stress urinary incontinence can really impact the quality of life quite significantly. Typically, patients with this problem, they suffer and they complain about this odor of the urine on the skin, as well as skin damage. It can really affect their sexual performance as well. A condition called climacturia, which is leaking urine at the time of climax or orgasm, that can be very bothersome for the patient and their partners.